I'm Kaser Nazir. I specialise in minimally invasive foot surgery, and in particular a keyhole bunion operation. What you're going to see today is that a bunion operation performed using this keyhole technique. Many patients ask me to be able to see how it actually happens. So here is a perfect example. I hope you enjoy this video. The foot is being cleaned with an alcoholic solution, and a sterile environment is created to allow for the operation to occur in a clean and sterile environment. At this point, I start marking the foot. I mark the bunion, the metatarsal, any blood vessels around there that we need to avoid, and it helps guide the operation prior to making any cuts or any bone deformity correction. I use a wire on top of the foot under X-ray to ensure that the bone cut margins are identified just for accuracy. There's no blood loss during the procedure because we squeeze it out and use a tourniquet for about half an hour during the procedure. So there's absolutely no blood loss, and it's a bloodless field, so it ensures the operation is quick and clean. A wire is then placed in the middle of the first metatarsal bone, which is part of the bunion deformity, where the screw will be guided over to hold the bone once it's cut. I use the X-ray in various angles to ensure that I'm in the middle of the bone and I'm in the right position before making a small cut. This small cut is in the top of the metatarsal, just behind the bunion deformity, and I will use this cut to access the bone. And then this bone burr, special bone burr, which is a tiny little rotation burr that cuts bone. And this is used in keyhole bunion surgery to try to cut bone, rather than the older techniques where we used to open the whole foot up on the inside and then use a saw blade. This is done through a little burr. And as you can see, there's no bleeding. There's a bit of water that's coming from the jet within the burr to allow cooling so that we don't burn the bone. Once the bone is cut, I check on X-ray, and then I reduce the deformity. So I'm moving the head of the metatarsal, where the bunion, in towards the second toe area, so that the width of the foot is reduced. And I check it again. Once I'm in the right position, the wire that I placed behind that bone cut enters into the main cut bone and holds it into the corrected position. And then again, we check multiple times and multiple angles on X-ray to ensure correct position. A second wire is then introduced just in front of the first wire, so that it can also hold the bone and provides extra stability and reduce any rotation that can happen whilst you're correcting the deformity. Again, many checks are made during X-rays during the operation to ensure that you have a full correction. A small cut is then made, and the length of the screw is measured using this length gauge that we have, and that will identify the exact length of the screw to be placed to hold the bone. I use this device to ensure that the soft tissues are protected from the drill, which can sometimes damage tissues, so that there's no damage to the tissues during the operation. Here we go, there's the drill through the bone, and once the drill is complete, then we can start to introduce a screw. So we go, here's the screw, the first screw that comes from the back of the metatarsal into the head of the metatarsal where the bunion has been corrected, and we place the screw across the bones to stabilize. Again, checking on X-ray regularly to ensure that we are far enough and not too far, or that the screw is not prominent, so that it's buried within the bone, and that patients don't feel any screws after the surgery, and it reduces the risk of them being ever needing to be removed. Once one screw is in place, a small cut is made for the second screw. And again, we're measuring the second screw now. Checks again to ensure that everything's in place, protecting the tissues once again. Drilling the second drill hole in the metatarsal. Carefully checking the position, and then introducing the second screw that will then provide extra stability to the bone. And these screws allow you to weight bear on the board of your foot straight away, because it's so stable that you can put all your body weight through it straight away. And that's why we allow our patients to walk for at least 10 minutes an hour, and even in the first week, and even from day one. The extra ledge of bone, once you've shifted it over, is removed so that there's no prominence on the inside against shoes, so that when you're wearing closed shoes or high heels, that there is no prominence left. And that is reduced, again, on x-ray. I'm just making this little cut here to take the bone out that has been cut, the excess bone that usually irritates shoes. I remove that carefully through that small incision in front, which I also used to cut the bone in the past. This is the final little cut that's made at the end of the toe, and this is to straighten the toe. So I take a little wedge of bone away so that the big toe is moved away from the second toe, so it sits vertically. This reduces the chances of any bunion coming back. It also creates a perfect alignment of the big toe and the forces when you're walking. And once this bone cut is made, the toe sits very straight in most cases. And the last screw is placed across this cut. So we place a wire temporarily so that we can make sure that the screw is going to be in the correct position. And these wires generally allow a cannulated screw, a screw with a hole, to go over it. So it just ensures that the screw position is perfect. As you can see, I'm checking that the toe is perfectly well aligned and very straight now. This is that final screw finally going in. We place that, we ensure that it is stable. We'll do some final checks. And then the final bunion bump here, which is the eminence is reduced. Once the bones are straight, we make sure that there's no sharp edges and everything's smooth. Then we wash out any bone debris from the grinding of the bone that almost forms like a toothpaste kind of a residue. It's like sludge that is removed. The procedure is complete. We close the cuts with stitches, and I find that whilst you can use non-stitches, stitches just are more likely to hold and provide better closure. A compression dressing is applied, and you maintain that dressing for 2 weeks. This is the result after about 4 to 6 weeks typically, and the patients, when we review them a number of weeks later, they are mobilizing trainers quite comfortably.
For about 5 years, I've had pain. It was stopping me walking. I needed to come somewhere where they did minimally invasive surgery, because I know then the scarring will be minimal, and it means I can get up and move in after 6 weeks. I had friends that told me that they'd had bunion surgery and how bad it looked afterwards. Mine doesn't look bad. I've been able to move. I've had no pain. That's why I came here.
Please do get in touch, and we will be happy to assist you with any queries you have regarding your bunions.